Hey guys, it's Dr. Ferguson, your friendly medical director. I'm here today in a very non-air conditioned 90-degree day in the at the Woodman Road Training Center to talk to you guys about a new airway technique. Hopefully you've heard some of the hustle about. It's called the SALAD technique, or the suction assisted laryngoscopic airway decontamination. So we've got our model set up here. I want to talk to you a little bit about the new catheters, the new suction catheters. You guys are used to this, the Yankauer suction catheter. The outside of this has been reinforced, and it's a very large device, but the real operating part of this is the internal diameter, not necessarily the outer diameter. So what Dr. DuCanto has come up with is this guy, basically taking the entire outside and making it all internal diameter, so you get a lot more suction, more bang for your buck. So these catheters should be rolling out very soon. They're in the process of ordering them and getting them into the ambulances. At least for the short course, hopefully these will be in all of your airway packs, maybe replacing the Yankauer altogether. If you look online, they talk about what these two should be used for. So basically, if you have somebody that's drooling a little and a little bit of dribble, these will still work. They'll work at your dentist office, but for contaminated airways and sucking up Denny-Moore beef stew or something very similar, this DuCanto device should certainly be a little bit better. So what we have here is our SALAD trainer. Sean has been nice enough to rig this to vomit somewhere in the neighborhood of 300 cc's per second, which is not, I'm exaggerating, but it's not too far off. And what we will be demonstrating is how to suction while you're intubating, and not just clearing the airway, but continually suctioning during the airway attempt. Our first intubation technique is going to be with the standard direct laryngoscopy, what most of you guys train with to start with and are most familiar with. And you've heard me talk about our airway success rate, so I want to reinforce the idea of having everything laid out and ready to go. Make sure you have your suction, your bougie, your backup sizes and airways, everything you need to do, everything you need to have to do the airway attempt without having to stop and bag and go back to your airway roll, your airway kit, in order to get more equipment. So hopefully I've got everything laid out that I need for this. I would have more equipment if this were a real airway attempt. Pardon the noise. Sean's going to get things started here and give me a little vomit. There we go. So I now have a vomiting patient. Peter, if you'll suck. I'm going to go in, visualize as I go in, looking for the epiglottis. I'm going to insert my catheter, clear the airway. Good. Then I'm going to park the suction catheter behind the vocal cords and park it to the side so that the tube stays. Bougie, please. Thank you. And Peter, if you'll load my tube onto the bougie.
All right, tube's coming.
Thank you. I have the tube. You have the bougie? Okay. Bougie out.
All right, bougie's coming out.
Go ahead and take it out. All right, the bougie's out, and then I can remove my catheter or leave it in until I get my cuff inflated and begin to bag. Good. Just to sort of re-demonstrate the actual suctioning technique and the idea of parking, I use my whatever intubation blade I'm going to be using to get my view as I'm going in. I suction just like normal until I can identify and see the cords. Then I'm going to put the tip of the DuCanto suction catheter into the opening of the esophagus, so I'm behind the cords, and then switch hands. I'm moving the suction catheter behind the intubating blade, and I still have my view of the cords. Then I can easily advance my bougie through the cords without the suction catheter being in my way. Now we're going to modify the technique a little bit and use it with the King Vision. So my vomiting patient has a contaminated airway. Thank you. And I'm going to suction. If I dive this camera directly into the pool of vomit, I'm not going to be able to see anything, so I want to suction as I advance until I can see the epiglottis. Once I have good visualization of the epiglottis, I'm going to suction behind and then park my catheter again to the other side so that it's in the top of the airway. And then once I'm in place, advance my tube in, peel that out to the side, and then Peter's going to bag for me. Now, let me get the cuff up there. Cuff is up. Good. So again, parking the end of that catheter just behind the cords into the top of the esophagus where the vomit or the blood should be coming from. Got one more technique to show you, or not technique, but one more round to show you, and I'm going to be using a borrowed CMAC here so I can actually record the airway view of this. And Sean's going to give me a little vomit. I'm going to grab my suction catheter and begin suctioning again as I insert the device, hitting record there. So I'm suctioning on the way down, identifying as I go. I've got a view of the epiglottis there. I'm going to lift the epiglottis, continuing to suction behind the cords. I'll suction the cords a little bit to clean those off. And then I'm going to park that catheter again behind the cords. Switch hands or switch sides there. My bougie's going down through the cords. Peter's going to load my tube onto my bougie.
Tube's coming.
Okay. I have the tube. You have the bougie.
I have the bougie.
Okay, we're going to advance the tube off the bougie. It's a little stuck. I'm doing my counterclockwise turn. And you may pull the bougie, please, and inflate my cuff. And you'll notice in the back there that there's vomit is continuing to come up, but instead of contaminating my view of the airway, we're actually continuing to decontaminate it. And as I come out, you'll be able to see where the catheter remained throughout the intubation attempt. All right.